AI will drive proactive guardianship. What does that mean to you guys?
What I think is, I sort of look at that and I think, when you say proactive guardianship, is there a structure in which you think about it? And I often go back to sort of the Hippocratic Oath, which is clinical responsibility. And how do you think about the development of artificial intelligence within the framework of clinical responsibility, do no harm? But remember, within the Hippocratic Oath is that phrase of practicing best medicine possible. And that's really making sure that AI is used to facilitate the quality of healthcare delivery. So I think the Hippocratic Oath serves as a good governing guardianship principle to say, okay, if what we're doing fits within that framework, then it's probably good. And if you're doing something that doesn't, you might ought to think about it a little more.
Jim, what do you think?
I almost use, from the primary care perspective, I always think about the annual wellness visit for my patients, and the idea is we want to collect historical data to really document a patient's chronic diseases and to think about the new and emerging conditions. We use this point in time to really pull a story together. And so when I think about that kind of proactive approach, is how am I leveraging what's already been available for us in a constructive way and help me predict the future of the things that are going to evolve, based on patient-specific conditions. So I kind of use that example of allowing me to kind of feel like that's going to help bridge the pre and the post. It's a whole input, processing, output of that experience.
The term proactive, I've thought about this for a long time, actually for decades. In my specialty, we see patients often over and over. And people always say to me, wow, it must have always different things coming in the emergency room. It's always very different. But it's remarkably similar, the types of stories. The people, the faces change, but the stories are very similar in that something happened and patients kind of drifted off a treatment plan. And it doesn't happen like that. It usually happens over time. I'm going to give you an example. This is incredibly common, something we saw over and over and over. And I know you saw things in your practice kind of in a very similar thing. But so one of the major public health problems we have today is falls, patient falls. And we'd have, a typical patient, 65-year-old gentleman who came in, sometimes fell down, sometimes had a laceration, sometimes had a wrist fracture, sometimes even more severe, had a hip fracture, sometimes really severe, not uncommon, had a head injury. And you think, if you kind of go back and would dig in a little bit, you talk to the family and the patient, you find out that oftentimes, they were having some difficulty with dizziness. This was really common.
Yes.
And then a really common thing, if you went a little deeper, was, well, they actually had high blood pressure and their primary care doctor was managing their blood pressure. And they recently increased their blood pressure medicine. And sometimes their blood pressure was really difficult to treat, so they gave them another blood pressure medicine. And then the patient ended up hypotensive, had a syncope, and had all these downstream things. And I always thought, gosh, we should have been able to predict that. We should have been able to monitor that and actually prevent all the downstream, morbidity and sometimes mortality that happened with that. And to me, that's sort of a example of proactive. We should be able to monitor, and we can. Technically, we can monitor these things, and we should be able to intervene way earlier, as opposed to this, our practice of medicine really for centuries has been very responsive, reactive. We're gonna patch you up after something happens, but it's really inefficient and it's really costly. And in fact, when you look at things, some of the major public health problems we have, heart disease, stroke, diabetes, our treatments, our responsive treatments are not great. Yeah, we can sort of rescue people and save them, but there all kinds of, negative things have happened by then. And so way more effective and cost effective and better for everyone if we could go upstream and predict these things. So that's kind of in the proactive mindset. That's what I think AI, one of the things I think AI, one of the great hopes of it is that it can help us finally achieve that.
Yeah, but I tie in the on the serve community, we just make sure there's got to be equity around it. Like we got to make sure that we're going to support all patients through this process. So as you get as further upstream as possible, we want to make sure that everyone is involved in that process, all providers, all patients. So I'm excited to see it work out.